Hi, Facebook. Happy Thursday. I hope you all survived the storm that hopefully didn't really arrive last night. I had my husband and son and I were all busy battening down the hatches for the predicted windstorm, which thankfully did not arrive, at least not with the severity that we were fearing. I had two Zoom calls last night that were very important, and I was fearful we were going to lose power, but thankfully we didn't. So I was able to have a great conversation via Facebook Live with First Selectman Matt Riska from Norfolk, which maybe you'll check in on. And also I participated in the induction to the National Honor Society of students at Houstonic Valley, which was a joy. It's such a pleasure to be with such talented and hardworking, skillful young people. So that was fun. And I'm glad that the storm did not disrupt that. I wanted to talk about today, I've had two briefings in the last week, which reminded me sort of more broadly about the idea of evidence-based policymaking. And I went to a conference, pre-pandemic, so it feels like eons ago, for state fiscal leaders by the National Conference of State Legislatures, in which we had a lengthy presentation from someone about evidence-based policymaking, and a couple of us from the legislature that went sort of joked about, like, shouldn't that be all the time? But sadly, it's not all the time, and because it takes patience, and it takes time, and it takes tenacity, and it takes being willing to reach out to experts who know more about a subject than you do. And so I had two opportunities this week to learn about things from experts who took the time. The first was the state hired a consulting firm called Mathematica to do a report on particularly how COVID hit nursing homes and other long-term care facilities in the state, because the lethality in Connecticut in particular, but across the country at long-term care facilities was significantly greater than in other parts of the population. And in fact, most of our fatalities come from long-term care facilities. And so it was really important to take a serious look at that as we make sure that we're prepared for any second wave or increased spread of the virus as we head inside. So they had a preliminary report a month or so ago, and they briefed us in a multi-committee meeting recently on their final report, which is 157 pages long, and it's probably just touches on many of the details. But one of the things, let me focus on one aspect of it, which is visitation. We shut down visitation to nursing homes early on because of the obvious risk that outside visitors bring in terms of infection into an environment, a congregate living environment where you have many people who are very vulnerable. So that made a lot of sense, and it did, it checked, although there were definitely gaps in the system, it checked the ability of the virus to enter those facilities. But one of the things that we all know happened, and any of us who have had loved ones in a nursing home can feel this, is that the absence of family for those residents caused real health deterioration. And that's both in terms of, the loss, the inability to see and hug a loved one can bring on depression and weight loss and other ill health effects. And also that in a lot of cases that a particular family member is often, a supplemental caregiver, and the absence of that supplemental level of care also had effects. So we have to balance those two things, because blocking one, trying to shut down the virus's ability to enter the facility while utterly depriving a group of people of the warmth and connection with their family is a real problem. And so this report tried to drill down on that and to help us create policy, I hope as we move forward, that will be more specifically focused rather than a broad rule that applies to everyone, but one that can allow families and institutions to work together to allow people to see their loved ones. But it's complicated because there are so many factors, and when you change one thing, other things change as well. Another briefing that we had just yesterday was from a group of scientists from Yale, which included clinicians, medical clinicians, biostatisticians, and public health professionals. And they were presenting to us on essentially the state of vaccines, how to look for where the next hotspot might be, and just to try to take a look around the next corner a little bit to try to understand what might be down the pike. And that was also, we had a couple of them, one of them apologize a couple of times for geeking out on us, which made us laugh because most of us on the call were very happy to geek out with these incredible public health professionals sharing their tremendous information and knowledge with us. And that's another area where, it's complex. It's we know that both your risk of becoming infected and the relative lethality of any infection are affected a lot by where you live. Communities of color have been hit harder. And that's partly because of, systemic racism over generations, a relative lack of access to quality health care, having jobs in which you cannot work from home, but you must go out and take risks. And there are a host of factors that exacerbate the virus's effect on that population in particular. And so as we make policy, we have to make sure we're aware of that, because just saying, treating every population the same when the impact is quite different is ill-advised. And another area that we have to start thinking about is there are several vaccine trials that are going on, and it does, there's real hope on that front. They have been accelerated. They were quite clear that there are, the scientific community is still, reliable, and that we will be able to hear from them as to whether to be sure that any vaccine has gone through the appropriate level of protocols for it to be safe and effective. But for sure we won't have, whenever we have it, which looks like, maybe mid 2021, we won't have enough at first. And so there will have to be decisions made about how to distribute it. And those decisions should absolutely not be about who has the resources to get it and who doesn't. And so how to make that work is also complicated. And, I have just the executive summaries for these two briefings are quite long, much less the full report behind them. But it really, taking the time to drill down into those details really is a big part of making good policy. So we're lucky to have access to such incredible resources. So I just also want to mention that I have one more Facebook Live later tonight with some returning champion town clerks. It's another chapter, I think it's chapter 3 in the series of the election and absentee ballots in particular. Lots of questions come up, and we want to try to answer as many as possible. So maybe you'll tune in later this evening at 7 p.m. So maybe catch you then. Take care.